Hello, my name is Mr. Salazar, and today in this video I want to show you guys how to work the AED. Now, things that you want to know about the AED is that there's lots of different models, all right? So once you guys go over to your different clinics, your externship sites, you want to become familiar with the type of AED that you have. Right? But one of the other things to also keep in mind is that AEDs have universal steps. All right. So for your guys' test, both the written and the practical exam, you guys need to remember that the first thing we do when the AED comes into the scene is we turn it on. All right. Now, I'm not going to turn it on right now. I want to walk you guys through how to place the pads first. All right. And so pads are right over here. And the trick here is stay calm, all right? Whether it's a real emergency or you're nervous for your practical examination, you want to stay calm, all right? These pads come with pictures, all right? So you can kind of see that there. And then this one, same here as well. You can kind of see that it labels them for you. So if I wanted to place these on my patient, I would go ahead and take a look at the picture. I would take a look at my patient. And I would see that this pad goes right over here. Same thing for the other pad. Take a look at the picture, peel off the sticker, and I would see that this one goes right over here. All right, so once the AED has been turned on and the pads have been placed, your job, if you're the person that's working the AED, is to follow the prompts, all right? It does not matter what the AED is detecting, whether it's ventricular fibrillation, atrial fibrillation, premature ventricular contractions, does not matter. You do what the AED says, all right? The AED will let you know if a shock is advised. The AED will let you know not to touch the patient if it's analyzing a heart rhythm. The AED will tell you if you should continue CPR. So do what the AED says once it's hooked up. All right. So once we've hooked up the AED pads, one of the things that you'll hear the AED say is, do not touch the patient, analyzing heart rhythm. All right. So at this point, if you're the person that's handling the AED, it's really important that you clear everybody. All right. So everybody clear, do not touch the patient. All right. The AED will say again, do not touch the patient, analyzing heart rhythm. So again, don't touch the patient, everyone. Make sure that you're standing away. What will happen next is that the AED will say, shock advised. And this little red button right over here is going to start flashing. Now, it's really important that we don't press this button until we've cleared one last time, all right? Your clear needs to be firm and with authority, right? So everybody clear, don't touch the patient, all right? And then you can press the shock button, all right? And then the AED will go ahead and ask you to continue CPR again. So let me go ahead and take these pads off and show you guys how it looks like. All right, so what's the first thing we do when the AED comes to the scene? If you said turn it on, you are absolutely right. So
remove clothing from the patient's chest.
Done.
Open packet and apply pads onto patient's bare skin. Press pads firmly on skin.
Look at the pictures.
Press pads firmly on skin.
I'm pressing on the pads.
Do not touch the patient.
Clear.
Analyzing
Don't
heart
touch the
rhythm.
patient.
Do not touch the patient. Analyzing heart
Don't
rhythm.
touch the patient.
Shock advised. Do not touch the patient. Press the flashing shock button.
Everybody clear?
Shock delivered. Begin CPR.
All right. 1, 2, 3, 4, 5, 6, 7, 8,
10.
9, 10. All right, guys. So the metronome that you can hear from the AED is meant to give you guys the rate of compression. All right. Now, if you are on 9 and the AED says 10, stick to what you're counting out loud. All right. And so again, like I told you, that once the AED is hooked up, you do what it says. All right. It'll let you know when another shock is advised, or it'll let you know if a heart rhythm has been detected. Right? And that is it, ladies and gentlemen. Other things to keep in mind, guys, if you are the person that is placing the AED, you want to work around the compressor. So we never stop CPR to place the AED. We have to work around the compressor. And compressor, if you're that first rescuer, you want to do exactly what you're doing. Just 30 compressions, 2 breaths, 30 compressions, 2 breaths. Do not stop until you've been asked to clear. All right, guys. So on your written test, there will be a few questions regarding the AED, and you want to review the special consideration sections, right? So what do we consider when someone has a hairy chest? Can we place an AED directly over a implanted pacemaker? What do we do when someone has a transdermal patch? Can we use the AED on someone that's submerged in water? Those are all questions that you kind of want to look up on your BLS book. All right. Thank you so much.